Good morning and welcome to UBLUR-TV. I'm your host, Brad Harmon, and today my guest is Dr. Trey Rigert with Columbia Pain Management in Hood River, Oregon. Good morning, Dr. Rigert. Welcome to the program.
Good morning, Brad. As always, pleasure to be here.
And we enjoy having you. Dr. Rigert, for almost 2 years now we've been talking about chronic pain and the different issues that people suffer with and the pain that they have. And we still have a lot of people out there that are asking, why do I still hurt and I'm still in pain, and do I need another back surgery, knee surgery, or shoulder surgery? Do you have any thoughts or answers for these people who are suffering with chronic pain and thinking about their third or fourth surgery to fix the issue?
Yeah, that's another great question, Brad, because we struggle with this every day in clinic. The patient comes in, they hurt bad, it's affecting their life, and they're quite convinced that some piece of their body is out of place, and they've been counseled that if only that piece was fixed or put back where it was, their pain would go away. And many of them have had 2 or 3 surgical attempts at putting that thing back where it belongs, but they still hurt. And so you get a scan and you find some things, because we all have things that are a little older as we get older. And then the question comes, if we trim off that bone spur, are all those pain signals going to magically disappear and you'll feel the way you did before you had chronic pain? And that's the hope, that some event, some surgeon with God in his hands is going to remove that bone spur and I will feel whole again. Unfortunately, for a great many of these people, that isn't the outcome. That isn't what happens. They have that 4th or 5th surgery and they're very disappointed because they still hurt. And the way I explain to people is, you have a pain system, just like you have a cardiovascular or heart system or a lung system or skin. You have a pain system. It's almost like an organ. It's just harder to see, right? And it can have problems itself. The pain system can get short-circuited. The volume can get turned up. And the original problem, the sprained ankle, the disc herniation, can be long gone, times 5. But the pain system can get stuck in the on position, similar to a short circuit in your light, or when your computer sort of gets stuck and keeps grinding away and won't turn off. The pain system can get stuck, just like your cell phone sometimes hangs up. And so typically, if your cell phone is grinding away on that app that isn't working, honestly, fixing the cracked screen isn't going to magically make it work, right? You have to have a software solution for a software problem. And that's where people sometimes get a little confused with chronic pain, because honestly, it can feel just the same. If the bone spur or the sprained ankle is there and you get acute pain, the chronic pain often feels the same. So it's hard for you to figure out, is it the pain system that's gone haywire, or is it still that disc or that ligament? So we try to help people wrestle with that. Honestly, sometimes they aren't very accepting of that message, Brad. They really want to hear that another surgery is the answer and there's a mechanical problem. And sometimes they actually think I'm telling them that they're imagining the pain when I try to tell them, your pain system's stuck on. No, doc, really, it hurts. Well, I know it hurts. I'm not saying it doesn't hurt. I'm not saying you're crazy. I'm saying you got a different problem. You got an electrical problem. You got a software problem. That has a different solution, and typically operating surgically on a software problem isn't going to get you back on the job or back playing with your grandkids. So it's hard to tease that out, hard to get people to understand it, maybe take a deep breath before they have that 3rd or 4th surgery. Kind of think about some of the other ways they can reset the pain system besides another incision. So thanks for asking, Brad. That's a good question.
That's good to know, and it is kind of confusing for us, the patients, because when our chronic pain starts, it's usually because of an injury or something's mechanically wrong, and then we get that fixed and the pain doesn't go away, so we think that there's still something broken.
Absolutely, and the thing that sort of contributes to that now is we can get these scans that are so enormously detailed that we find all these disc bulges and we find every bone spur in your whole body. It's taken us a while to realize, though, that that's in many people part of the normal aging process. You go out and scan somebody that doesn't hurt at all, and they're going to have little bone spurs and some disc bulges, and that's part of who we are as we get older and gain wisdom and maturity. So it doesn't necessarily mean that you're going to have any positive effect by trimming off that maturity and wisdom in a surgical fashion.
That's good to know, and I'm sure that's an important solution. So what should someone do if they're suffering from chronic pain? They've had procedures performed, they're thinking about another one. What should their plan of action be?
Yeah, they need to seek counsel, and they need to seek at least a second opinion. And they need to be mindful of the message that's delivered. If it comes down to, gosh, Mr. Smith, another surgery has kind of a small chance of helping, and maybe we should look at your lifestyle, your mindfulness, your diet, your weight, your exercise regimen, biologics, that type of thing. So be receptive to the message and seek counsel.
That's good advice, and as always, we appreciate you sharing that with our viewers.
Thanks for asking, Brad.
And thank you for joining us on UBL URTV. I hope you'll join us again soon on another broadcast.